Welcome. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I want to thank you for joining us for the June 13th, it says June 10th on here, but it's the June 13th session of the cross-industry update with Boulder County Public Health concerning COVID-19. We know that we have a lot of people joining us today, so we appreciate you continuing to come on these calls, ask your questions, get the information. We know that it's been a little while since we've done one, since December, so welcome to 2022. We're still here. We're still available for you. There is one change. You will notice that our presenter today is Tessa Hale with Boulder County Public Health, and she is going to be taking over the responsibilities from Lane. We might see Lane here and there, but she'll be joining us on these webinars. So at this point, as people are joining, I'm going to hand it over to Tessa to start us off. We do have a rather lengthy presentation from epidemiology and on the data and updates for you, but we will get to your questions. Please put them in the Q&A if possible. Chat's your second option, just so that I can capture them easily with as many people as we have on these webinars. All right, Tessa, take it away.
Thanks, Corinne. Good afternoon. As Corinne said, we have a longer update than usual. As you all know, we're in the middle of a big surge, and we just want to be sure to give you all of the updated data and some recommendations on how to keep the community safe. So this data is updated as of January 10th. And I want to start off with some key messages. One of the first being that because of the enormous surge that we're in, our staff are unable to collect and verify some of the surveillance data regarding race and ethnicity and municipal data during this time. And so we won't be reporting on that until we get to a place where our staff is able to get back to our typical protocols in terms of collecting and verifying that data. What we're seeing in Boulder County is akin to what's happening in the state and nationally. There's just a huge surge happening. Cases have risen dramatically over the past 3 weeks. Positivity of cases, of testing cases are rising, and hospitalizations are also increasing. And just to reiterate, the surge that we're seeing is happening across the globe, and the breadth and the strength of the surge requires further action when we are all very depleted. We've been in this pandemic for over 2 years, and we're at a point where it's hard to keep going and to maintain some of these best practices for staying safe, but we're really urging people to do that at this time. Things are changing really quickly, whether it's CDC guidance, whether it's the shifting nature of this pandemic. So we're doing our best to provide you the most up-to-date information. The 3 goals we have are really the same as they've been all along, which is we want to prevent severe illness and death. We want to protect our healthcare systems, make sure that our hospitals maintain capacity. And we want to get back to our return to normal as quickly as possible and get back to even as close to normal as we can using safe practices. The modeling shows that we will have a peak in cases at the end of this month or in early February, and that hospitalizations are on about a 2-week lag time following that peak. We're seeing an increased hospitalization of children. There is new booster guidance, so kids 12 and up are all individuals 12 years and older are now eligible for a booster. So if it has been 5 months since the last dose of a full course of vaccination, which is 2 doses for Moderna and Pfizer and 1 dose of Johnson & Johnson, you are eligible for a booster. We strongly encourage everyone do that. Omicron is having an impact on how we're looking at our strategy of what to do and how we take action. So we're having less of a focus on cases and more taking a look at hospitalizations and the impact on our healthcare system. Because Omicron is spreading faster and it's coming on more quickly, waiting for testing results to isolate is too long. So masking is really the one way to be sure that if you were to have it, you would be protecting your community, and wearing a mask is also protective for you against people around you who may have Omicron. Testing to release from isolation isn't as helpful, and tests are in short supply, and there's a shortened infection period. Contact tracing is of limited support right now. As I shared, our staff are completely overwhelmed. Normally, during a surge, we could rely on the state to provide some support. They are providing support across the entire state. So the idea that we would be able to contact everyone who has been in close proximity and exposed to COVID isn't a reliable way to stay safe right now. And isolation quarantine is shortened based on CDC guidelines, which I will talk about later in this presentation. We're seeing significant business disruption due to staffing shortages. We're seeing that in early childcare education centers. We're seeing that in schools, in the jail, law enforcement, hospitality, grocery stores. Just across the board, everyone is really significantly being impacted. Additionally, we're also seeing all of the disruption due to the Marshall Fire. All the families and people who are displaced because of the fire, people congregating together in a way that was unexpected, and then staffing in response to the fire has also limited the ability for us to respond in the way that we would ideally be able to. So here is just some update details on Omicron. So from the time an individual is exposed until the onset of infection, it looks like it's about 3 days. It is 5 times more infectious than Delta. I'm sure most people on this call know at least one person right now who has Omicron. It's really raging through the community. Hospitalization appears to be lower, so that is positive. The estimate is 25% lower and 50% lower if there was a prior infection. We know that the vaccination is highly protective against this, although after the 9 weeks after the second dose of an mRNA vaccine, protection is lessened, and that a booster significantly increases protection. So overall, Omicron is spreading quickly and before we know. It is in a business, in a school, and so wearing masks is really an important way, and social distancing is an important way to stay safe. The highest risk is within households with exposure prior to being diagnosed. Vaccination and boosting are really an essential way to reduce risk. The viral clearance is more rapid among vaccinated persons, so that means that people who are fully vaccinated against this are going to be not infecting others more quickly than people who are unvaccinated. In situations where transmission and virus burden is high, isolation and quarantine are more limited than before. Just for, as I shared earlier, that the onset is much quicker and it's much more highly contagious, and so those practices aren't as protective as they previously were. So masking, air ventilation are really important until transmission decreases. Here is where we are right now. We have, on average, 1,243 cases per 100,000. It's off the charts in terms of our positivity rate right now, our cases. The highest increase is among our 23 to 34-year-old population, followed by 35 to 44. As you see, in all age ranges, cases are up. 72% of individuals hospitalized for COVID in the state are unvaccinated. So this just goes to speak to how protective vaccinations are against this variant of COVID-19. Hospitalizations in the region increased 34%. We've seen an increase in pediatric hospitalizations. There's significant staffing shortages at hospitals, 62%. The medical surgery beds and ICU bed availability is relatively stable. and there's less urgent care being redirected, which is positive. Pediatric ICUs, ventilators, and PPE metrics have not exceeded their thresholds. ER visits and waiting times are increasing. Significant staff cases in fully vaccinated hospitals are increasing, even though the healthcare workers are fully vaccinated. There's just so much exposure. And facilities and healthcare systems are closing satellite locations right now just to ensure staffing at main locations. And healthcare systems are adopting guidelines to manage staff shortages. Some changes that are happening within the healthcare system: cloth masks are being eliminated. We're really moving towards KN95s, and we'll talk more about masking a little bit later on. There's a combined hospital transfer center plan that's activated so that patients are transferred to best managed resources available. Crisis standards of care for emergency medical services are in place, and what this means is that there could be people being treated for COVID, people coming in from a car accident, a stroke, a heart attack, other reasons, and crisis of care standards have to be implemented where the decision is made about who receives treatment. CDPHE enacted crisis standards of care this past Friday. The last time that happened was in April of 2020. What this means is only the most severe patients will be taken by ambulance to hospitals. Some patients will be taken to urgent cares and other non-hospital facilities that would normally be taken to the hospital. Guidance on the kind of treatment to provide and PPE are no longer providing life-saving treatment. And this may result in not transporting some patients or declining to resuscitate some patients, such as those in continuous cardiac arrest. So this really just speaks to the severity of where we are right now in the pandemic. And Vista Adventist, which had to be evacuated due to the Marshall Fire, is expected to be back online in 2 weeks, but certainly the impact the fire had on having that hospital evacuated and patients and healthcare workers moving to other hospitals has also had another burden on our healthcare system. The capacity for the region, the average number of hospitalized confirmed COVID patients increased 34% in the week ending in last week in the North Central region, and the largest one-day increase since the beginning of the pandemic. And staffed ICU bed availability averaged 7%, which was up from 6% last week. As I said, that there's about a 2-week lag time between cases and hospitalizations. And so, while this is somewhat positive, we're not expecting that to last. Surgical bed availability averaged 4%. Tight staffing, as I mentioned, there's 62% of hospitals with significant staff shortages. And now there's 44 pediatric confirmed cases of COVID-19. Currently, there are 101 people hospitalized with COVID-19 in Boulder County, and there are 7 ICU beds available in Boulder County. The number of cases exceeds epidemiological capacity. This means that in terms of contact tracing, following up on letting people know that they've been exposed to COVID is far surpassing the capacity of staff. So additional responses right now, we're having a mass vaccination site at the Boulder County Fairgrounds. Appointments are required. There have been revised school quarantine and isolation guidance to try to support online learning. If you all have kids in school, you know that they are making preparations for having to go online for certain classes or schools, depending on availability of teachers and rates of COVID-19 within classrooms. We're continuing to recommend to communicate people take extra precautions. Our vaccine verification program participants, we're highly encouraging masking right now, even if you are approved to be without masks. We're suggesting the use of quality masks and wearing masks outdoors, and to reduce non-essential social interactions and for people to work remotely when possible. Our surveillance and epidemiology teams are managing really challenging data situation. There's data lags, things are continually changing, people are out sick, staffing shortages. We are, as I mentioned, pausing work-intensive data collection and further prioritizing contact investigation, contact tracing. And then you see there's the support to fire victims at our Disaster Assistance Center in terms of distributing masks and gloves and test kits, providing vaccines to people impacted by the fires. We've had 67 deaths since May 2021. An interesting thing to note about this slide is early on, most of the deaths were associated with long-term care facilities. As you see the data now, people are dying and they're not people who are in a long-term care facility. The testing rates, as you see, at least 1/4 people who are going through our local testing at Stasio or Boulder County Fairgrounds. We have 1 in 4 people in Boulder County have COVID. This does not account for home testing that's not reported or people who are not testing. Right now, our vaccination rate is, of our entire population, 67% of people are populated. Of our eligible population, 70% of our population has had a full course of vaccinations, and 92% have had 1 dose of COVID vaccines. This is what we're looking at, is how many people have had a booster, a 3rd dose, for anyone who is 5 months out from their last, having completed their full vaccination protocol is eligible. And you'll see here that we're seeing, there are a significant number of people who could still receive boosters within our community. This is a graph from the National Institute of Health that shares how much more protective a booster is against Omicron. And so we're really encouraging people to go ahead and get boosted if eligible. This is something we're anticipating that the CDC and State Department will soon have a booster be considered part of a full regimen of being vaccinated. Right now, we're really encouraging people to take extra precautions. First and foremost, get vaccinated, have your family vaccinated, get boosted, wear a high quality mask. We look at N95s, KN95s, and now there's the KF94s. KF94s are manufactured in South Korea and are also really protective against the spread of COVID-19. When possible, increase airflow and ventilation, leave windows cracked, avoid large gatherings, wash your hands, get tested and isolate if you're sick. So if you're sick and you have not tested positive, please isolate anyway. There are home tests available free from CDPHE. I know a lot of places are sold out of home test kits. And so if you're unable to test, we just really encourage you to stay home. Isolate for 5 days if you've had a positive test, even if you're asymptomatic. The updated isolation guidelines are here. The CDC came out with these at the end of December. So if you test positive for COVID, the following day starts as your count 1 day, and you stay home for 5 days and isolate. If you have no symptoms, or your symptoms are resolving and you're fever-free for 24 hours, you can leave your house, but you need to wear a mask for 5 additional days. And if you still have a fever, stay home until your fever resolves. And this also means that you have not taken any kind of fever reducing medicine to reduce your fever. The updated quarantine guidelines are different if you've been vaccinated or not. So if you were exposed to somebody with COVID-19 and you have had your booster or you've completed your primary series of vaccine, then wear a mask around others for 10 days. You don't need to stay home. It might be advisable, especially if it's a family member who's sick or that you know that you are highly exposed to somebody. On the 5th day of exposure, test. And if you develop symptoms at any point, stay home. If you are over 6 months out from your series of vaccination or had a series of J&J over 2 months ago, or you're not vaccinated, If you have been exposed to someone, please stay home for 5 days. And after that, wear a mask for 5 additional days. And then test on day 5, if possible, again. Here is our list of resources, and I will, share this slide deck with Corinne to get out to everybody.
Well, Tessa, that was a lot of information you had to go through. So thank you for doing it so clearly and, trying to get the information out. We have a few questions that have come in, a lot about the vaccine verification program, which happens to be your area that you help manage. So that will be good. That will cover some of those, but let's start with a couple of data points, just clarifications on them. Are those 44 pediatric cases that are hospitalized because of COVID, or are they hospitalized and it turns out that they have COVID?
That's a great question. Yeah, I know that there's been a lot of news about what's called incidental COVID, of people in hospitals testing for another reason and testing positive for COVID. Those pediatric cases are because of COVID.
Okay. And then just to clarify, the ICU bed, we only have 7 ICU beds left in the county. We do have a couple ICU beds offline because Avista is offline, correct?
Yes.
And then ICU beds are being used by more than just COVID patients. Those are used for car accidents, cardiac incidents, strokes, any type of incidents. So those 7 ICU beds are for anybody who needs an ICU bed within the county.
Yes, thank you for clarifying that. I think that this is something that we just continue to try to stress, is that when we're looking at the healthcare system being maxed out, we're talking about anyone who has any kind of emergency situation or ends up needing an ICU bed. They are limited because there are people with COVID in the ICU right now, and we're trying to reduce that burden and keep people out of the ICU for COVID.
And someone just wrote in that this morning's paper said that Avista might open a lot sooner than originally indicated. So they might actually open as soon as next week. And I'd heard, potentially that was the case. So once they open, we'll be very thankful to have another hospital back online, and very thankful that Avista is able to come back so quickly. Could you give an example of a satellite location that is closing to assist in staffing shortages?
I can't tell you offhand, but I will look into that, and I will get Corinne information on what specific satellite locations are being closed.
In the beginning of COVID, some of the hospitals and some of the locations, they consolidated their staff into particular one location so that they weren't spread out, so that they could, make sure all the they had enough MAs, they had enough PAs, they had enough doctors. So they were consolidating to, they might have closed down this clinic and sent everybody to another one. So I know that happened in the beginning of COVID. So
Right.
Any examples of what's happening in Boulder County would be great to send out.
Yeah, we can do that. As noted in the presentation, 62% of our healthcare settings are experiencing staffing shortages. And so I can try to get a list of all of those different places impacted.
I feel like that's my dog, but it's your dog. So I'm afraid my dog's going to do the same thing. So, all right. So a lot more questions came in. So let's be patient as we get through these. Just to answer one question, this will be sent afterwards. We'll have a recording as well as the PowerPoint and all the links that were provided. That is always sent, so I will do that. Speaking of testing, the home test, they do publicize the home test on the state website. They did take away the option for most organizations to get bulk supply of those unless you fall into certain categories. So individuals can request them. I do want to note that it does take a little while to get them. So it's not an overnight process. I did order, a testing kit myself just to see how long it took as a sample case, because I do have some, and it's taking a couple weeks. If you're in certain industries, you might have access to them, but it is hard. There's a limited supply right now of those home testing kits. Do you have any advice for businesses? I get a lot of questions on where do I get these testing kits? And then the second part of the question is, how effective are these home testing kits, non-PCR home testing kits, in detecting Omicron?
Thank you for those questions. So first, I wish I had a great resource to share in terms of getting bulk home testing kits, and I do apologize. There's a delivery person here. I can, talk back with the people who source those at BCPH, but I know that that's just a challenge across the board right now. I'll see if I can find some ideas. In terms of accuracy of home testing, I think essentially you have to have a higher viral load for those to detect it. So they would be at an 85% accuracy is generally what I've seen as compared to a PCR test can be up to 98% accuracy. And so typically the home test works better for someone who is at least 5 days out from exposure and is probably symptomatic. They can catch the non-symptomatic cases, but they're certainly not as sensitive or as accurate as a PCR test.
Everything I've read is also say don't rely on one negative home test as your, oh, I can go see grandma now. You might need to test multiple times as well. And that's why you might see there's a lot more limited supply. A lot of people are testing more often. So as far as the testing supplies, we do have access if you have the money to spend on at-home PCR tests. There is a company in Boulder that is providing bulk PCR tests at a rate that's pretty reasonable for PCR tests. So you can get in contact with me, but you do have to pay for those. Those are not free. And those can be dropped off at the lab in Boulder, and they have been able to get results pretty quickly. And it is a Boulder company, and it's got the same FDA approval as the at-home tests that are the Binats. All right, wow, we have a lot of questions that just came in. Let's go through the vaccine verification program because that'll cover quite a few. So will you be changing the requirements for the vaccine verification program to require a third shot or a booster shot at any point, especially for J&J?
That's a great question. Thank you for that. We are highly, highly encouraging people to include boosters as a part of their vaccine verification program. We've heard from several businesses. They've let us know that they have decided that they are requiring boosters for their vaccine verification programs. We, as a public health department, have determined that we're going to wait for either the State Department of Public Health and Environment or the CDC to call that as a part of your being considered fully vaccinated. So we are encouraging it. We think people should be doing it. The data shows, as I shared on that graph, how much more protective it is, but it is not, we're not currently changing any parameters of the program right now.
And some companies are, like you said, are taking the initiative, even companies not on the vaccine verification program. CU Boulder, for example, is now going to require a booster of all students, staff, and faculty as of a February date. So anything special about the J&J, especially since that was only one shot? Is there any special, any special recommendations around the J&J?
So right now, as shared with the quarantine protocols, we're looking at the protection factor of J&J really being about 2 months in terms of being protected against and being protected from spreading COVID-19. So we really encourage people who have had just one dose to go ahead and get another vaccine. This is where people have talked about mixing and matching, and we would encourage a Pfizer or Moderna booster. There aren't J&J boosters, but you would get a different dose, a different brand of vaccine. I
think this question is coming from the business side, though. Like if my employee or somebody coming in only has one shot of J&J, is there anything specific I should do there, especially since, the data is it's very different for J&J than it is for some of the other vaccines.
Right. So from a business perspective, given that the quarantine for someone who has had J&J 2 months out is going to be 10 days, it would be highly recommended that someone who's had the J&J follows up with a booster of Pfizer or Moderna if they're 2 months out from their first dose of J&J.
It's very important for a business to know what type of vaccine their employee has, because if they have J&J, their quarantine time will be longer according to the quarantine rules. How should VVP or vaccine verified program facilities respond to customer questions about not requiring masks based on this widespread transmission of Omicron, even amongst vaccinated people?
Well, as I shared, we've been communicating with our vaccine verification program participants that we're highly recommending masking during this time. And so we're not closing the program down, we're not shutting it, we're not mandating masks, but we're highly, highly encouraging it. And so I think if you're a business who's opting to not have masking, then it would be about speaking to, you're participating in this program, and I guess my point is really people should be masking at this time, especially if you're getting questions from people coming into your facility. I think that people are feeling much safer being masked right now.
Masked in a fully vaccinated facility. So that's like double protection in that arena. I know that, for example, we're having an event, and it is a VVP event, we're requiring vaccinations, but we're also going to do the social distancing, and we're also going to recommend the mask wearing and provide surgical masks and K95 masks. So, we're just, it just provides that extra level of protection and safety that people might appreciate.
Yeah, thank you, Corinne, for setting that example, for the chamber to be setting that example. And I'd also just want to say here that we're not talking about doing this forever. I just want to, we're looking at, we are in, the middle of a surge, we're going to hit the peak and anticipate that it will come back down. And so what we're doing right now is just taking extra precautions during a limited period of time.
And you're still accepting new applicants for the VVP program, correct?
We are. And I would also say that we are short-staffed on the VVP right now with medical leave and paid time off. So it is taking a little bit longer for the review process.
All right. So someone just said that they did receive 4 free testing kits delivered to their front door, 3 to 4 days after they order, but that was mid-December. It's taking a little longer right now, but you can go in and individuals can order for testing kits from the state. So I just wanted to follow through on that one. Someone just gave their personal experience there.
And Corinne, I would just add, I know this isn't as relevant to businesses, but to individuals, that Biden is requiring insurance companies to reimburse people for up to 8 home tests per month, just as if people want to take a look into that.
Okay, great, thank you. If you can get your hands on any, I think every place out there has a sign on their front door that says, no, we don't have any tests right now. I've seen those, and I think it's like the hot commodity right now. Do you have one? Do you have one? So if you I was afraid to even say I have one in my house right now. What are the current mandates on small business? What are the current mandates a small business can make on requiring vaccinations? Can a small business require vaccinations?
Yes, any business owner can put into place any policy that they choose. And with regard to employment law around this, I would suggest Corinne has some great resources.
And we have, in the email I sent out yesterday, I'm continuing to send out the link to the recordings, and I label them legal guidance. We had 2 lawyers come, we actually now 1 lawyer come on and 1 person from Employers Council talk about requiring vaccinations, requiring masking, internal and external. And those have continued to follow through. Watch those. The lawyer was at the beginning of the presentation. It was a really long presentation, but the lawyer was at the beginning, and DJ did a really good job of clearly outlining when you can require, uniform practices, what you need to do, and some of the resources that you can look at. So please take a look at those, and I'll continue to send those out. I'll link to the it's on our YouTube. If you go to YouTube/Boulder Chamber, you'll see them also on the YouTube page. I also put them in the chat here in just a minute. Since the CDC said that cloth masks don't lessen the spread of Omicron, will the mask mandate be lifted? And also, why outdoors? What's proving that we should do it outdoors?
So no, the mask mandate won't be lifted. We've shifted to recommending those stronger, more protective masks. Any mask is going to provide some protection. We just know that the N95s, K95s, and KF94s, or I think I have that wrong, are providing additional protection. Why outside? You know, I think that actually the Denver Post ran a great story 2 days ago that has a chart that talks about different levels of risk. Being outside is much lower risk. We're just taking all extra precautions that we can right now. If you're outside in a crowded area is when we would recommend wearing a mask. If you're alone walking in nature, we would not suggest that you need to wear a mask. It's really if you're going to be around other people where respiration could be something that where you would be picking up COVID-19.
All right. Thank you for answering that question. Let's go back to VVP real quick. How long approximately are applications taking? Just wondering because someone applied last week and they're just kind of wanting to get a sense.
You know, 2 weeks, hopefully within 2 weeks time, we'll be able to get to those. And
okay,
go ahead. Go ahead.
Finish that thought.
I mean, I'm just going to say, you know, we're in a place where we are continuing the program, and to the way that Corinne and the chamber are modeling this, you know, being vaccinated and wearing masks really ensures that people in your safe are super safe. So we encourage people who are in the VVP program to also be masking.
So we're highly recommending it. Have there been cases of COVID-19 at VVP facilities or outbreaks or those types of situations?
We have had one business had 2 people with getting sick, and then there was a one-time event where a few of the guests got sick. That's all that we know of. We were doing a weekly check of outbreaks with the VVP program. I will say that during this surge time in the last 2 weeks, we haven't been able to cross-reference those, so I can't say 100% if there aren't more businesses that have had outbreaks.
Well, your staff is facing both the surge, and then your staff is also helping with the Marshall Fire and the Disaster Assistance Center. About masks, do faith communities have a mask exemption? Somebody's asking because they're noticing a lot of people not wearing masks in the faith communities.
No, there is no mask exception for faith communities. They should also be wearing masks.
Okay.
And if people are concerned, if people are in a space and notice that there's a lot of people not wearing masks, particularly people who are staffing a business, you can go online to our website and report a concern. We have an enforcement staff that are following up with places that aren't following the mask mandate. So we would encourage you to go ahead and report any concerns you have through that mechanism.
Great. And yeah, and then there's also a call center and some other, there are places on the website to report that. Is there any concern with folks using N95, KN95 masks and then limiting the availability to healthcare workers, or is that not an issue right now?
Yeah, that's a very thoughtful question. I think right now, healthcare centers, healthcare facilities have sufficient PPE. We're not seeing the same kind of PPE shortage that we saw. The testing kit, the home testing kit shortage is what we're dealing with right now, but with PPE, there seems to be sufficient masking for people, whether it's for their personal use, businesses, and healthcare settings.
Great, thank you for that. So let's talk a little bit about if you take a test at home, and we know some of this data might be under-reported. I know some people that did the Binax tests and they didn't report that they had it. So, you know, there might be those people taking those tests, they have the positive, they're isolating, but they're not counted in the numbers that you showed. If you are self-testing and you need to report a positive home test, how do you report that? Is it on
That's a
the
great
Boulder
question.
County Public Health side or on the CDPHE
The
side?
CDPHE, and I will get that to you, Corinne, but yes, and we really do appreciate and encourage people who test positive at home to go ahead and report that. It's important for us to have accurate data about where we are in terms of positive cases. So we really encourage people to go ahead and self-report when they get those home tests positive.
And I might be able to put that link in the chat as well if I have a moment. What is the current outbreak criteria for businesses? Is it still 5 or more cases within 2 weeks? And what do you have to do if you have an outbreak? I know that the state site sends you to a phone number that is basically the front desk at Boulder County Public Health, and it got a little bit of people a little bit frustrated. But what is your current recommendations or requirements for a business that believes they have an outbreak?
Yes, I will drop the email into the chat. We have an epi business team that will be able to respond to you and provide you information on reporting and how to manage the outbreak, and also how to how to know once you're out of that outbreak status. So I can put that in the chat.
And it's now I've sent it out. I think moved, and it's now 5 cases that in a period of 2 weeks is considered an outbreak. And
yes,
okay,
thank you.
Right. What are the current guidelines for consuming? Thank you, Tessa. Send that to everybody. What are the current guidelines for consuming food and beverages? Is it still mask off only while eating and drinking?
Yes, that has remained the same.
But the seated part is not in there. It is while in the act of eating and drinking, and that was, and it's not specifically called out that they have to be seated, correct?
Right, that's to take into account people who may be at a one-time event like a wedding or at a music show with a beverage.
How quickly can someone be reinfected after initial infection with COVID?
I don't know the answer to that. I can look into it. I don't think that the science is out on that. I don't think we know, and I think that this new variant has sort of changed what we thought we knew about the virus, and we certainly don't have enough time past people being infected with Omicron to know about reinfection. But I can find out from our team if there's information I don't know.
Thank you. When they get a chance. We have a couple questions coming in about the new isolation and quarantine guidelines, which, as you know, we got a lot of questions when the CDC changed them. I was answering a lot of questions. You were answering a lot of questions for me. Considering that it happened over, during the break time. Regarding the counting the days of isolation, is the first day, does that start when you have symptoms or from the testing day? As there could be some days between the symptoms and getting the actual result.
That's a great question. So if you are symptomatic, and say you're symptomatic, your day 1 of being symptomatic, you go to get tested, you get the test results 48 hours later, the day 1 would start after the day of your test, if that makes sense. So you're symptomatic, you get tested, the next day would be your day 1 if you come back positive. The CDC shortened this to try to keep continuity of operations, to keep schools open, to keep things functioning. But it is really important that people still adhere to paying attention to whether they have a fever, whether their symptoms are subsiding. It's not hard and fast 5 days after you either are symptomatic or positive that you can be back out in the community wearing a mask. If you're still highly symptomatic or feverish, you need to continue to stay home until your symptoms subside. At the time your symptoms subside, then you should be wearing a mask for at least 5 additional days.
Anybody I know that's had Omicron and had some of the nasty cases of Omicron, it's been more than 5 days with symptoms. And so, what I've talked to businesses about is, it's not 5, if they still have symptoms, then the 5 days is not a hard stop 5 days, like you just said. It's, and you also have to do that symptom checking, just like we did back in March of 2020, April of 2020. August of 2020, like some of the symptom testing, some of the businesses are asking, can they, require people to stay home the full 10 days?
Businesses can, and we've been flooded with questions around pay for people, COVID pay to stay home because they're symptomatic or they're sick or they're exposed. So this is kind of, a challenge that we're seeing in terms of the legislation covered 10 days of being sick when people are being reinfected. And so, I think that this is something important for employers to be thinking about with having their staff stay home while they're symptomatic and sick, is what the sick pay situation looks like.
And I do want to point out that in the last email, I did send out the notice about HCFA. This has been another area that I've gotten a lot of questions about, because state of Colorado has its own legislation around sick pay. It has been extended into 2022 because we're still under a public health emergency. I sent out the information that came out from the Department of Labor and the 2022 sign that is about, what is this year's rules, those and that and so forth. So please know that HCFA or HCWA is still in effect in 2022, and that affects that sick pay or that the pay in regards to COVID. So please look at that. It's a pretty lengthy. I put in everything that the Department of Labor sent out, as well as the links to the Department of Labor, links to the website, and the link to the 2022 poster, because that is a question. A lot of people have the assumption that it went away in October or went away in 2020. And so just be clear. And if you need to, you might need to consult an attorney or consult an HR in like an employer's council or something like that if you're uncertain about the rules and how they affect. All right, so when discussing quarantine and isolation for folks who have tested positive or been exposed, is it safe for them to return to a job in food service industry while masked after a suggested 5-day? That's a question a lot of businesses are having.
I think this goes back to what we were just saying. I think if the individual has been fever-free without any fever reducers for 24 hours, the symptoms have subsided, and they're wearing a really effective mask, the CDC has said that this is okay. So, we're going by CDC guidelines, State Department of Public Health and Environment, Colorado State Department of Public Health and Environment guidelines. And so I can't speak, I'm not an infectious disease doctor as to like what level of risk that is. Those are the guidelines that we're following per the CDC.
But that changed to a K95 mask. You could, require that employee to wear a K95, a higher quality mask as well during that time, or all employees to wear those masks as well. Right. Question regarding the state exposure notification system, and I have the same question. Not sure how much you know about this, but do you know the range duration required to receive a notification? I know some people are receiving multiple notifications in 1 week just from going to places. Do you know, how do you even figure out when you get an exposure notification system what you need to do next, or what day it could have been, or do you have any insight on that?
I wish I did. I am one of those individuals who has received those notifications, and then I have absolutely no idea when or where that was. I can try to find out an answer to what that range and duration would be. I think when you get that kind of notification, it's just important to be really mindful of how you're feeling. If you start to have any symptoms, I think a scratchy or a sore throat is oftentimes the first symptoms of the Omicron variant. Just be really mindful of that. If you're out wearing a mask, when you're in public spaces wearing a mask, I think that you can just sort of heed this warning and be mindful of how you're feeling. But I think it's a system that maybe is somewhat helpful for you to be thinking about how you're feeling, but I don't know that it's not pinpointing that you definitely have been in close proximity and exposed. It could be that you've passed by someone in a grocery store. You
can go into settings. So on my phone, I went into settings and it tells you number of days back that you were exposed still made no sense for me because it happened to be Christmas. And I was only around certain people on Christmas and I don't know anybody. So I think there's still some confusion around that. Somebody just brought up this that you can go back. But some businesses are also getting confused because they'll get calls and say, hey, I was only at your location on this day and the exposure notification system says that I was exposed. So I was exposed at your business. Why didn't you inform me? And so I think there's some questions as what is the requirement of the business when someone calls like that? Are you required to do anything unless you're being told that you actually had a positive case at your location on that day?
If a business does not have a known positive case or outbreak, then I think that they can inform the customer of just the fact that we have no known cases at this business. And that's
it's just, I mean, it's one of those systems that helps you just judge whether or not you've been exposed. And like you said, check out your symptoms. Potentially, if you have symptoms, go to get tested. But I think there is some confusion, and I've heard of a couple businesses get called. Can you please, if you're able to, can you please address the news that UC Health is allowing COVID positive staff members go to work?
I am not able to address that. And I guess the question being, why is that possible, or is there more detail around that question? Just
all right, enough. Are there any advice resources you could share for businesses, especially cafes, restaurants, on how to adequately enforce customers being masked, even while seated, except when actively eating and drinking? You go into a place and there's no food or drink in front of them, but as soon as they sit down, they take off their mask. We're seeing very few people following this mandate, employees struggling to enforce.
First, I just want to say that I'm really sorry that you're in this situation. I know it's been really challenging. It's a big burden on your staff to have to be the enforcement people in this scenario. And what I can do is I can meet with our communications team and ask if we can get a communications out around the order, and clarifying that while you're not actively eating and drinking, that you need to be wearing a mask. I wish that there was more that I could do. I think it's it's a challenge. And I guess the best that we could do is try to more clearly communicate that and try to support your business and your staff in that way.
Yeah, we used to have signage, but it was signage that was in Boulder County Public Health. It was just signage that said, unless in the act of eating and drinking. It might be helpful to have some of that businesses could put out just so that it shows it's someone else that says this. In addition,
yeah, we could definitely do that, create some signage.
In addition, we need to change the mask signage or add additional parts to the mask signage that clarifies what types of masks are actually allowed under the order. Not gaiters aren't allowed. Certain types of masks are actually not allowed, so that businesses aren't having to say, it's not really, well, it's a mask. Well, better clarifying that in.
Yeah, thank you. I know you'd asked for that. And I think I'm realizing that I think the fire waylaid.
So no, I just wanted to mention that businesses are also facing that, and it's something they're facing as well. Any other questions? I'm going to do a last call for questions. We've talked about the testing shortages. We talked about, the rise in numbers. We talked about vaccine verification program and recommendations. The program's still going. Any other questions out there? All right, so next week's session. So next Thursday, we have a special session. We're bringing in a trauma care expert who actually has worked a lot with Boulder County Public Health and has worked all over the nation with people in dealing with high stress situations. So they're going to talk about customer collision. He's going to talk specifically about customer collisions and helping your staff through this prolonged period of customer collisions. And I'm calling it customer collisions because we all know there's been, around, vaccine requirements, around masking, around all of these items. It's been almost 2 years. So we're bringing in somebody to help you just understand what might be going through the minds of your staff, how to handle some of this and some of the emotional aspects of it. So we're doing that next week, and then we'll follow up the following week. It'll be Tessa and I back on talking data and so forth. So that is what we're doing over the next 2 weeks, and then we'll figure out if there's another hot topic that we need to do. But we thought this was an important topic to bring up, especially since stress levels are higher for a lot of reasons in the area. So we just want to take into account what you've been going through for the last 2 years, the constant frontline stress that you've been going through, and maybe provide some support and ideas and whatever we can do in that area. Until next week, you can register on the website. I provided the link yesterday. I will send out an email with the recording, with the PowerPoints, with all these links again. But in the meantime, if you have any questions, please let us know, and stay safe, stay healthy. Thank you, Tessa, for taking the charge. I've gone through a lot of people at Boulder County Public Health, but I appreciate you guys continuing to offer the service to our community.
Thanks, Corinne.